Post-Operative Instructions, dental implants. Immediately following surgery. The gauze pad placed in the surgical area should be kept in place for 30 minutes. Once you are home, please change the gauze and use firm biting pressure over the extraction sites until the bleeding stops. Vigorous mouth rinsing and/or touching the wound area following surgery should be avoided on the day of surgery, as it may cause bleeding. Take the recommended pain medication as soon as possible following the surgery, ideally before the numbness from local anesthesia has worn off. Restrict your activity on the day of surgery and resume normal activity when you feel comfortable. Bleeding. Slight bleeding, oozing, or redness in the saliva or gauze pad is not uncommon and is expected. When the gauze pads have little or no blood on them, they are no longer necessary. It can take a variable amount of time for bleeding to resolve, but usually resolves within a few hours, although a small amount of bleeding is common for up to 24 hours. Excessive bleeding, i.e. rapidly fills up or pools in your mouth, may be first controlled by gently rinsing or wiping any old clots from your mouth, placing a fresh gauze pad over the surgical site, and applying firm biting pressure over the extraction site for 30 minutes. Swelling. Swelling may not be present immediately following surgery, as it usually increases or peaks in the days following surgery. It can take a variable amount of time for swelling to resolve, but usually improves within a week or two. To minimize swelling, apply an ice bag or a plastic bag or towel filled with ice on the cheek or jaw outside the surgical area. Apply the ice continuously, 20 minutes on, 20 minutes off, for the first 24 hours as tolerated. Keeping the head elevated with a couple of pillows for the first few days following surgery can help reduce swelling. Some patients, especially those on blood thinners, may experience cheek or jaw bruising following surgery. Diet. In general, you may return to a normal diet as soon as possible, unless otherwise directed. For the first day of surgery, eat soft foods and drink liquids, as this will help with discomfort and help allow blood clots to form undisturbed. Avoid hot liquids and hot foods, as these may cause discomfort. You should be encouraged to eat regularly and drink plenty of fluids, as these will help with recovery. It is advisable to chew on the opposite side or away from the implant site during the healing period. Pain. Pain may not present immediately following surgery, as it usually increases or peaks in the days following surgery. It can take a variable amount of time for pain to resolve, but usually improves within a week or two. You should take non-steroidal anti-inflammatory drugs, NSAIDs, example ibuprofen, as first-line pain therapy, unless otherwise stated by your doctor. The recommended maximum daily dose of ibuprofen is 3,200 milligrams. Typically, 2 to 4 200 milligram tablets may be taken every 6 hours. If you are unable to take NSAIDs, acetaminophen, example Tylenol, is recommended as first-line pain therapy. Typically, extra-strength Tylenol may be taken every 4 to 6 hours. Ibuprofen and Tylenol, taken simultaneously, work as well or better than opioids in their pain management effect. You may be prescribed an opioid pain medication, example hydrocodone, acetaminophen. Typically, this is prescribed for breakthrough pain and can be taken with ibuprofen as a substitute for Tylenol. If your ibuprofen alone does not improve your pain, you may take ibuprofen and the opioid together. It is recommended to take pain medication with food, as this will help prevent nausea or stomach irritability. If you're taking an opioid pain medication, you should not drive or operate heavy machinery. Oral hygiene. You may begin gently rinsing the mouth with warm salt water the day after surgery and continue for 1 week. You can dissolve a half teaspoon of salt in a small glass of warm tap water. Smoking should be avoided. Smoking may increase bleeding, increase pain, delay healing, cause infection, and cause implant failure. Activity. Unless told otherwise, avoid vigorous physical activity, strenuous exercise, or heavy lifting, greater than 20 pounds, for 3 days following surgery. Early physical activity can increase your blood pressure, which can cause an increase in swelling, pain, and bleeding. Other considerations. In the event of nausea and vomiting following surgery, do not take anything by mouth for at least an hour. Sutures placed will dissolve in approximately 5 to 7 days following surgery. Sometimes they become dislodged or fall out. This is no cause for alarm. Just remove the suture from your mouth and discard it. Slight elevation of temperature for the first 24 to 36 hours following surgery is not uncommon. Tylenol or ibuprofen may be taken to reduce the fever. Your lips should be kept moist with an ointment such as Vaseline. Sore throats and pain when swallowing are not uncommon as muscles get swollen. This will subside in 2 to 3 days. Stiffness, trismus, of the jaw muscles may cause difficulty in opening your mouth for a few days following surgery. This is a normal post-operative event which will resolve in time. If you had a sinus graft performed at the time of your implant placement, avoid blowing your nose, do not use a straw, and sneeze with your mouth open for 2 weeks following your surgery. If you've been provided a prosthesis, such as a flipper or an excess retainer or a full or partial denture, these generally can be worn immediately after surgery following confirmation by your doctor that wearing them will not disturb the surgical site. Most implants heal uneventfully and take 2 to 4 months to heal.